From the Blind Ability Studios, it's Wellness Wednesday with your hosts, Beth Gustin and Robin Ennis.
Well, welcome back to Wellness Wednesday. I can't believe we're in December already. My name is Beth Gustin, licensed professional counselor in Colorado, and I am here with my co-host, Robin Ennis, a licensed clinical social worker, also here in Colorado. And today we are talking about depression. And so similar to our episode back in August where we talked about anxiety, we are going to define the different types of depressive disorders for this first episode. And then we'll go more in depth into one of them on the next episode.
Right. Just like anxiety, depression can be very common, especially during this time with holidays and whatnot. And so it is our aim that you all gain a lot of valuable information and being able to apply it to your life and thinking about some of the symptoms that you may be feeling or a loved one or friend may be feeling in some ways to be able to support yourself or someone else.
As Robin was saying, there are different types of depression, and we are going to define some of these. When we think about depression, we think of kind of some basic symptoms like overall sadness or just feeling down, irritability. Depression can show up a lot of different ways, and it looks a little bit different in men than women. There are a number of different types of depression, including major depressive disorder, and that's what most of us probably typically think of. Your typical symptoms that last longer than 2 weeks, and this is going to be characterized by, like I said, the intense sadness, frequent crying, feeling down, loss of interest in activities, nothing is fun anymore, no energy, you probably sleep way more than you need to or normally would. That's kind of the major depressive disorder and how that looks for most people.
And I just want to add to that a few things too, is that also with major depressive disorder, a sense of irritability tends to be common too. So if you're feeling worthlessness and having the lack of appetite or sleeping too much or too little, what may be. Also too, you may feel like you're always on edge or you're being more quote unquote snappy with other people, and so that can be a sign. Another sign is just like anxiety is thoughts of suicide. So if you're starting to feel, again, with those thoughts of worthlessness and hopelessness, you're starting to feel like, why am I here? What is my purpose? Why am I around? And just really starting to have more pessimistic thoughts and thoughts about harming yourself. That can be a symptom of depression too. And so that's really important to pay attention to on how you're feeling in that realm. It's like a sense of heaviness. It's really hard and it takes a lot of effort to be able to get motivated or to get up in the mornings. You know, sometimes depression, major depressive disorder can be genetic or it can be environmental. You may find sometimes that depression may run in your family. I have a few clients who have mentioned that they've noticed that one of their parents was depressed and that kind of trickled down to them and their siblings and now grandchildren. Knowing how to be able to cope yourself can also help people around you learn how to cope and deal with symptoms.
And don't be afraid to reach out for help. Not all depression needs medication, and medication can also be really helpful when we are trying to work with depression. Talk to your doctor, talk to your therapist, reach out and get the support you need to figure out what is best going to help you cope with your depression, because it does not have to run your life. Bipolar is a second type of depression that also runs in families. And bipolar is also what we think of as manic depressive. And so we have kind of episodes of a really high mood, feeling euphoric. Some people might engage in more risky, impulsive behavior. And then we see the opposite. They have really low moods and low energy, and they're maybe feeling suicidal and more worthless, and the typical depression symptoms like we just talked about. Also, if you have a manic episode, you might notice that you or someone you know has what we call pressured speech, where they're talking really quickly, really rapidly. It's almost like they have so many things in their head, they just cannot get them out fast enough.
Right. An example of the fast-paced speech is one famous person who is known to have bipolar is Britney Spears. And so if you paid attention, I'm a pop culture fanatic. So if you pay attention to all of the media attention surrounding her and listening to some of her testimony in court, you can notice the rapid speech that she had. And so that is definitely a symptom of, as Beth said, a part of mania with bipolar. Another thing too is just like major depression is that with bipolar, there tends to be a part of that impulsive behaviors is that there tends to be anger. And so it's not knowing how to be able to express that anger and you're more reactive with bipolar. I have a client who mentioned that, well, actually two clients mentioned that their impulses in regards to that. So one client said that she reacts on a scale. She goes from 0 to 100 in 10 seconds. So it's very rapid and very quick. And so it's hard to be able to control her behaviors in that moment. And same with another client. He said he goes from 0 to 300, but he feels like in 10 seconds. So it can be very intense. And there's different types of bipolar. There's bipolar 1, which you have mania, and then there's bipolar 2, which you have hypomania, which is a more lesser intensity compared to the regular manic episode. Did I explain that correctly, Beth, or did I leave anything out?
No, I think you covered that very well. And I know we're kind of throwing a lot of information out on this podcast. We just kind of want to give you a brief overview of the different types of depression that are out there. And then you can work with your healthcare professionals to determine which one you're experiencing and what the best course of support and treatment would look like. A third type is perinatal or postpartum depression. And I am actually glad to see that society is talking about this a lot more than they used to. This typically starts in pregnancy and can occur for up to 1 year after the baby is born. And in extreme situations, this can look like where mom can't get out of bed to care for the baby. Our hormones are all over the place when we're pregnant and post-birth. And so it's not uncommon for moms to have symptoms of depression during and after pregnancy.
Exactly. And I'm glad, Beth, that you said that it's not uncommon because especially with postpartum depression, I feel like a lot of women form that guilt about having those feelings after pregnancy because pregnancy is supposed to be a joyful and happy time. It feels like a burden to them to have those feelings of sadness because it's like, well, I must be a bad mom. Why am I feeling this way? When actually you're not a bad mom. You're human and your body is going through a lot of change and a lot of things are happening internally. It doesn't mean that anything is wrong with your maternal ability to parent. It just means that you need some extra support right now.
Exactly. Another type of depression is called persistent depressive disorder or dysthymia. And I tend to think about this as what I call low-level depression, sort of like hypomania, but a little bit different in that this is a low-level depression that you kind of constantly have. So you might be able to go out and see a movie with your friends and kind of enjoy that experience. But as soon as you're done with that, you're feeling blah again. So it looks similar to major depressive disorder, but in my experience with my clients, it's a less intense form of depression.
Yes, and that's my experience too. It is a lower, lesser intense form of depression. And typically it's more so, I believe you have to have it for at least 2 years or so, ongoing symptoms in order for it to be diagnosed. But yes, it's something that's more manageable compared to major depression, where it seems like you feel more weighted down on your day-to-day activities. Beth, I'm glad earlier that you mentioned that we are throwing out a lot of diagnosis and information. And so I don't want to speak for you, Beth, but I believe that it's our aim. The reason that we're sharing this information is so that if you do have any of these symptoms or you do think that you may have one of these disorders, try not to diagnose yourself through Google, as people tend to do, Google doctor, but rather talk to your doctor and a professional and know that you're not alone. So that's why we share a lot of these different disorders and information with you, because again, you're not navigating this by yourself. There are people out there who are facing a similar journey as yours.
And you are correct, Robin. In my experience, it is 2 years or longer for the dysthymia, as I tend to call it. And yes, I did not look up the exact number. I meant to look it up before this podcast of how many people are living with depression, but it is a very high number. And so you're not alone. And our goal is to just raise awareness. This is how these disorders can look. And if you have any one of these symptoms, you have to have more than one to get a diagnosis. There's a whole another podcast on how we diagnose. But talk to your doctor and make sure that everything is going okay for you. And don't be ashamed because, as Robin said, you're not alone. And these numbers of people living with these different disorders are very high.
And there's also a combination. So as Beth mentioned earlier, whether it's medication or talk therapy or both, it's whatever works best for you. And so collaborating with your professionals to see one or the other or both. And the end goal is to make sure that you're able to regain a level of happiness in your life and live the best life that you can.
I was going to move on to a different type of depression just to cover a couple more people have maybe heard of but may not be as familiar with. So one other type that women also get to deal with and men don't is premenstrual dysmorphic disorder, or PMDD. It's a severe form of PMS, and so women will tend to experience depression and symptoms of depression usually 1 or 2 weeks prior to their actual menstrual cycle. And this can also be characterized by extreme anger and irritability and lashing out. And so we see kind of more of the anger spectrum in my experience with clients who do have this. And I don't have a lot of experience working with this specifically.
I don't have a lot of experience working with that disorder per se, but I also believe that there tends to be a stigma surrounding that particular disorder because just in general, women are stereotyped to be more moody. And so if somebody is having more intense anger or depression during their menstrual cycle, I feel like it's drawn out more in their quote unquote PMSing or whatever it may be. And it causes people to not want to be diagnosed as much for that fear of the stigma.
I agree with that 100%. And there's a lot more to it than just what I described. And again, talk to your doctor if it's a concern you have. But I do think it is definitely stigmatized and shouldn't be. At the risk of trying to inject some humor in here that I hope is not offensive, I think men can have some monthly cycles too. We just don't talk about it. We don't call it that. I think all of us are prone to what I'm going to call monthly mood swings. And whether it's environmental, whether it's chemical, whatever, I do think it is normal for both men and women. But women tend to get more categorized and more stigmatized because of our monthly cycle.
Yes, exactly. And just remember that we all are human. Yes, we all do have mood swings, just that some may have it more often than others or for a particular reason.
No symptoms should go untalked about or unchecked. Because if you're feeling off or not yourself for any reason or for anything, get it checked out. Because none of us feel good 100% of the time. We're all human and we all have challenges and we all have emotions and mood swings. But if it's persistent, talk about it with somebody. There's one more type of depression. There's more than probably that, but one more that we were going to talk about. And I think we're going to talk about this more in depth on the next episode because this is the season for seasonal affective disorder, also known as SAD. And seasonal affective disorder usually starts in late fall or early winter and usually goes away in the spring and summer. And this has a lot to do with the fact that the days are shorter, the sun goes away earlier in the day, it's colder, it's dreary, it's dark, and a lot of people are truly affected by this lack of sunlight that we all need physically and emotionally feel better. And so symptoms of depression will show up around this time of year. The holidays don't help because they can be a really hard time of year for a lot of people. But seasonal affective disorder typically, like I said, starts around October, November, and typically goes away in the spring.
Exactly. And that's what I was going to say too. I'm glad that you touched on it, is that with the holidays, with Thanksgiving and whatever holiday you may celebrate, it can bring up a lot of variety of emotions. So no, it doesn't help seasonal affective disorder, and it can make people feel more depressed and have that level of debilitating depression accompanying with it. But yes, we will talk about that in the next podcast. And so in general, coping, strategies with any of these types of depression, it's always good, as we've mentioned several times throughout this podcast, talk to somebody, get a diagnosis so that you can try and figure out a best way to treat those symptoms. And thinking of what makes you feel better, what helps you cope, whether it be, as we've mentioned in other podcasts, music, journaling, grounding techniques, being around loved ones or friends. I know during the pandemic, it caused anxiety to increase as well as depression, especially more social people, more extroverts tend to have levels of higher depression when they feel like they can't engage in those social arenas that they're used to. So if you're feeling more isolated, get out with friends, try and find a hobby or activity to do to help you. There's a plethora of ways to be able to navigate and cope with depression.
Add a couple to that. There's exercise, there's trying to eat healthy, there is changing up your morning routine. So just kind of changing things up so your brain's like, well, this is different. What are we doing? Little small things like that can help. And this is probably one of the harder things to do. But if you can, quote unquote, force yourself to go do the thing you don't want to do, like go to lunch with your friends, you will find you feel better. But bottom line, be gentle with yourself as well. Listen to your body and what it needs and get the support you need.
Yes, exactly. And even going off of that, Beth, I'm glad that you brought that up is diet. Yes, diet definitely impacts our mood. People who tend to feel more depressed tend to eat more carbs or more sweets and sugars. And so that can make you feel more weighted down. Something I read online is that foods high in acid tend to be more linked to depression rates among those who have MS. And so I thought that was a really interesting study. So they said that people who have MS who eat more eggs or meat or grains, foods with high acid tend to have higher levels of depression compared to eating more vegetables and fruits and things like that. So yes, please pay attention to your diet and, as Beth said, your exercise. Beth, is there anything else that you want to add before we end our podcast?
No, I think we will leave it here. Like I said, we've given you a lot of information and we welcome any questions. We welcome any topic suggestions. We welcome your feedback, good, bad, or otherwise. We want to know if this is working for you and what you'd like us to focus on.
Exactly. And if anything that we touched upon today, if you feel like you can relate to it, or as Beth said, any questions, we definitely want to hear from you. We enjoy the feedback that we get from you. So keep it coming. Until then,
take care of yourselves and we will talk to you next time.
You can send Beth and Robin a message at 612-367-6093 or by email at info@blindabilities.com. They'd love to hear from you.
When we share
what we see through
each other's eyes, we can then begin to bridge the gap
between the limited expectations and the realities of blind abilities.
And the realities of blind abilities.